Hello, Namaste. I am Dr. Krishna Chaitanya, Consultant Vascular and Endovascular Surgeon at Aster RV Hospital, Bangalore. I am here to talk about a topic which is not familiar with anybody. The topic is called aortic aneurysms. Now, what are aortic aneurysms? Let me tell you, the blood in our body is pumped through large tubes called as blood vessels. There is one main large tube which supplies blood flow to almost all parts of our body, and this particular tube is given a name called aorta. Now what happens, since the flow in this tube is very high, the pressures in this tube is very high, it is prone to get damaged and sometimes results in ballooning of this tube. Now this particular ballooning, abnormal ballooning of aorta is called as aortic aneurysms. It can affect anywhere just beyond the heart, inside the chest wall or in the abdomen, where we call them respectively a thoracic aortic aneurysm or an abdominal aortic aneurysm. Who can develop aortic aneurysm? Let me tell you, if Albert Einstein could develop abdominal aortic aneurysm, anybody could develop abdominal aortic aneurysm. Aortic aneurysms can affect elderly population, more so if they have had a history of smoking, a previous heart disease, a previous stroke. If there is a family history of aortic aneurysms, patients who have had long-standing bronchial asthma or asthma problem, those who have had breathing problems, all these people are prone to develop aortic aneurysms. How do I know if I have an aortic aneurysm? Aortic aneurysms unfortunately do not have any symptoms. Most of them do not even realize they have an aortic aneurysm. It is very important to actively screen all people who are at risk for developing aortic aneurysms to know if they have an aortic aneurysm. Why should I worry about having an aortic aneurysm? When the blood vessel balloons out, it starts stretching. When it reaches more than 2 times its size, there is a very high risk that it might burst open and there might be exsanguination of blood in your body, leading to massive internal bleeding, which can be quite life-threatening. Therefore, it is very important to screen elderly population who are specifically at risk for developing aortic aneurysm. Now, doctor, I have been diagnosed as aortic aneurysm. What do I do about it? Do not worry. Your doctor would suggest an appropriate diagnostic test, which could be either a CT angiogram or an MR-based angiogram, to know the pattern of your aortic aneurysm and suggest you an appropriate treatment. How are aortic aneurysms treated? The treatment of aortic aneurysm is based on several factors: the age of a person, his fitness levels for the surgery, and the pattern of the aortic aneurysm, whether there are any major blood vessels arising from the damaged part of the aorta. If a person is fit for the surgery, the ideal option would be to do a bypass surgery, where we resect or remove the affected part of the tube and we replace it with a new artificial tube called as a graft. What if an aortic aneurysm affected person is not fit for the procedure? Let me tell you, most of the people who have been diagnosed with aortic aneurysm are in their 70s or even 80s. We have a good result treating these population. Most of them have been successfully treated here at Aster RV Hospital by using minimally invasive techniques. We have state-of-the-art hybrid cath lab where we are able to treat a large abdominal aortic aneurysm using an incision as small as 2 inches. We treat this aneurysm by a technique called as endovascular aortic aneurysm repair, wherein through small holes in the blood vessel, we pass a stent which has been covered by a lining of graft material called endograft, and we bypass these affected arteries internally. Patients are usually able to walk on first or second day after the procedure, and they are able to return back to their normal activities almost within 3 to 4 days. Most of these procedures are carried out on local anesthesia or sometimes under mild sedation. Therefore, there is not much of morbidity involved in doing these procedures. So, if you have any of the elderly at home, or if you have people who are elderly who have known risk factors for development of abdominal aortic aneurysm, like they have a history of smoking, they have a history of heart disease, they have a history of stroke, they have had a long history of lung or breathing problem, long history of diabetes, or a family history of aortic aneurysm, please get them screened to know if they have an abdominal aortic aneurysm.